Okay, so a little bit of a summary on what is Inside the O'Briens and what the book is about. So basically, it's about a 44-year-old police officer named Joe O'Brien, and he's married to his wife named Rosie O'Brien, and they had 4 kids. They're all in their kind of young adulthood. The 3 youngest are JJ, Patrick, and Megan, and the oldest daughter is named Katie, and a lot of the book is told in her perspective after Joe's diagnosis. So basically, in the beginning of the book, they're a very happy family. They are Catholic, and they're living a very good life. Joe really loves his job. He really cares about being a police officer, and it's a lot on his personality, and it matters a lot to him. Until one day he experiences being more aggressive and his behavior changing when it comes to Rosie making dinner. He just finds that he's losing his temper a lot quickly, even with his kids. And then one day he goes to work and he ends up having a muscle spasm accident with a drill, and he ends up hurting himself. And a lot of Joe's co-workers go to Rosie and say, hey, you should go to the doctors and get this checked out. A lot of Joe's friends say that he's drinking too much alcohol, making jokes about it. Joe is on the fence of going to the doctors, but eventually Joe and Rosie end up making the decision to go to the doctors just in case if anything's wrong. The doctor then sends Joe to a specialist, and the specialist then diagnoses Joe with Huntington's disease. So after Joe got diagnosed with Huntington's disease, he didn't really know what it was. Neither did his wife Rosie really understand how he got it or what the symptoms were. But basically the doctor described to him that it is a disease that affects parts of the brain that control balance, movement, problem solving, behavior, emotion, thinking, so that within 10 to 20 years that this disease will slowly take his life, and his symptoms will worsen to a point where he will not be able to walk and his muscles won't be able to move as they used to. He will be more confused and he would get more frustrated easily, and that eventually he'll need a caregiver and he'll have to be put in a home because he's unable to live independently. And yeah, Joe O'Brien, he ends up having to lose his job as a police officer, which makes him depressed. And also the doctor told Joe and his wife that there's a 50% chance that his kids can inherit the mutation, so therefore they would get the disease too. And all the kids kind of they are told that, and they kind of experience whether they want to get tested or not get tested and live life to the fullest, but knowing that there's a risk that they could get this awful disease. And through all of their own separate lives, Joe slowly, his symptoms worsen and he gets railings installed in his house. He gets a wheelchair. His wife Rosie becomes his full-time caregiver, and his kids basically have the choice on whether to get tested or not for Huntington's disease. Basically, towards the end of the book, all the kids have the choice on whether to get tested or not get tested for Huntington's disease and just kind of live life to the fullest. Joe's 3 youngest kids, JJ, Patrick, and Megan, they all choose not to get tested and live life to the risk that they might have it or they might not. So they basically, towards the end of the book, they spend as much time with their father as they can with the short period of time that he has left. And the last kid, Katie, she's the oldest, she was really on the fence of getting tested because she wanted to have kids, but she didn't want to have kids if she knew that she had the Huntington gene and that she couldn't possibly pass it down, and she wouldn't want to have kids if she was going to put in risk that her kids were going to have that disease. So she ends up choosing not to get tested at the end of the book, and just to spend time with her father and not have kids yet but have kids later. And yeah, Joe doesn't die at the end of the book, but his symptoms severely worsen, where the book's kind of hinting on what's going to happen but doesn't actually like let it happen in the book. But yeah, that's a little bit of a summary on Inside the O'Briens. It's basically, in the beginning of the book when you first open it, it's a whole paragraph on spreading awareness on Huntington's disease, which I think is really important because unfortunately my father went through Huntington's disease, so I really know on a personal level and I could really connect with the book. But yeah, I really appreciate that it's spreading awareness because it's a god-awful disease. And yeah, so that's a little bit of a summary on Inside the O'Briens. So now I made 6 questions about Huntington's disease, and I really hope that you can learn something from it and maybe learn about the more of the scientific details of Huntington's disease and more of the societal details as well. So yeah, let's get right into it. My first question is, what is Huntington's disease and how does it progressively affect your brain function and physical movement? Okay, for starters, Huntington's disease is an inheritable condition caused by a mutation in the Huntington's gene, which I will go more into depth later. This progression breaks down nerve and brain cells in the human body. And this degeneration primarily affects areas in the brain like the basal ganglia, which is responsible for movement, cognition, and emotional regulation. Additionally, it affects the cerebral cortex, which is responsible for functions like thinking, memory, perception, and awareness. So these are all very vital parts of the brain that are needed for humans to function properly. So when these areas are affected, it makes it extremely hard for an individual to live their daily life, which is unfortunately the areas of the brain that Huntington's disease effects when you have this mutation, and you will undergo severe symptoms of loss of coordination, changes in behavior, involuntary movements, and overall cognitive decline. But the main symptom of Huntington's disease is loss of mobility. So you will have difficulty with balance and coordination, and you'll have significantly trouble in walking and muscle usage. Most people that are diagnosed with Huntington's disease will likely have mobility issues for the rest of their life. As time goes on, the symptoms will worsen, unfortunately. But symptoms usually form when you have Huntington's disease, usually in your adulthood, ages from 30 to 50. And also, symptoms can occur in children and adolescents, typically in ages under 20. And this is called juvenile Huntington's disease, which is the same as regular Huntington's disease, but just affects the youth. And it is more deadly because it happens more quicker and they undergo the symptoms much quicker than regular Huntington's disease. So yeah, there's the answer to the first question. Okay, my second question is, how is Huntington's disease passed down through families, and what does the inheritance pattern reveal about genetic disorders? Huntington's disease is an inherited autosomal dominant pattern, meaning that a child with one affected parent has a 50% chance of inheriting the mutation and getting the disease. Only one copy of the altered gene is needed to cause the disease out of two parents for the offspring to get it, which is really scary. But more on a deeper level, the Huntington's mutation involves an abnormal expansion of the CAG trinucleotide repeat. But there's a range on how many repeats you can get of the mutation but not experience any symptoms. So firstly, an individual could have 27 to 35 repeats. They will not develop Huntington's disease, but they can still pass down the gene to their offspring. If an individual has 36 to 39 repeats, there is a small chance that they will develop the disease, but a higher chance that they'll live a life without displaying any symptoms. But if an individual has 40 or more repeats, they will develop Huntington's disease and show symptoms in late adulthood. The mutated gene segment is made of cytosine, adenine, and guanine, which leads to the production of an abnormally long toxic version of the Huntington's protein, therefore causing the disease, which you will see up on the screen right now. The inheritance pattern reveals that some genetic disorders don't require both parents to pass on the gene for the disease to appear, hence why Huntington's disease is on the more dangerous side of genetic diseases, because it can spread by only one mutated gene in a whole family. For now, my third question is, why do symptoms of Huntington's disease typically emerge in adulthood rather than earlier in life? And how does this delay affect diagnosis and treatment? So Huntington's disease typically emerges in adulthood, most common in ages 30 to 50 years old. But because of its progressive neurodegenerative disorder that requires decades for the toxic mutant proteins to accumulate enough to cause brain cell damage, which then produces noticeable symptoms, which can result in symptoms occurring usually by that time in adulthood. So it's because that the proteins take years and years to kill the nerves in your brain, which will eventually lead to you having physical symptoms of thinking, coordination loss, and everything like that. So it takes a long time, even though you have the mutated gene by birth, but by the time you're like 50 years old is when the symptoms start showing and when you are usually diagnosed with Huntington's disease. But to this day, there is no cure for Huntington's disease, unfortunately, regardless of if you have it in adulthood or in childhood. But however, the disease is genuinely considered easier to manage when you're in adulthood than the rapid progression seen in childhood cases, also known as juvenile Huntington's disease. But juvenile Huntington's disease, it does progress a lot faster and generally harder to treat, and its severe early neurological decline and how fast it occurs, it's just much harder to treat compared to adult Huntington's disease, which is still a fatal condition, but it's slower onset in adults, which provides a longer window to potentially add new therapies and further decrease the severe symptoms you will experience. Okay, for my fourth question is, approximately how many people worldwide are affected by Huntington's disease, and how do the prevalence rates vary by region or population group? So an estimated 135,000 to over 200,000 people are affected by Huntington's disease globally, though some sources may suggest that the numbers are even higher due to an underdiagnosis. The global prevalence is often cited at approximately 4.88 per 100,000 people, although the rates may vary based on different regions of the world. Huntington's disease is most common in populations with European ancestry, especially in North America, Europe, and Australia, ranging from 6 to 14 per 100,000 getting infected. The rates are much lower in Asian and African populations because Huntington's disease may be underdiagnosed in those areas due to the limited of genetic testing and neurological health care in those certain areas, possibly due to not enough people educated for that field or not the finance to hold that kind of equipment. But those are some ideas on possibly why it's much lower in those areas. Another theory too is that certain populations have a higher rate of Huntington's disease due to the founder's effect. So the founder effect is when a small group of people carry the Huntington's disease in a certain area and they have many descendants. So over generations, the mutation becomes more common in the population due to the mutated gene being constantly passed down and spread. So that could be another reason why that some regions have a higher rate than others. Also, communities like Venezuela, Northern Scotland, and even isolated European countries have a usually high rate of Huntington's disease in the world as well. Scientists don't necessarily know why it's higher in those regions, but another cool theory is that in 1860s is where Huntington's disease was founded in Scotland. So maybe it just stayed a high concentration ever since. But yeah, that's just what we think. Okay, my fifth question is, what do statistics show on the average age of life expectancy for individuals with Huntington's disease, and how do these numbers impact long-term healthcare planning? After experiencing early symptoms of Huntington's disease, the average life expectancy afterwards is around 15 to 20 years. And Huntington's disease itself doesn't usually cause a direct death, but it's usually because of complications like pneumonia, infection, choking, injury, and reduced mobility is usually the cause of death for a patient with Huntington's disease. And these statistics have a major impact on long-term healthcare planning because of Huntington's disease is a progressive in someone's life and the people that surround their life as well. Individuals often require years of medical care such as neurological treatment, physical therapy, speech therapy, and mental health support as well. As the disease advances, many people lose the ability to walk or drive and complete everyday tasks independently. And over time, families become long-term caregivers because they have to alter their life to help the person with Huntington's disease, which is usually in their family. But this can cause not only emotional stress, but financial stress too for both the patient and their loved ones. Healthcare systems must only prepare to increase demand on assisted living facilities and specialized nurse care and disability support and genetic counseling services. Additionally, since Huntington's disease is inherited, families may need support by decision making about genetic testing for the disease before future planning, so they don't possibly give it off to their offspring or to their children, and then they'll be at risk in getting the disease too. So having genetic testing facilities is a strong demand in the healthcare system. But overall, the statistics surrounding Huntington's disease shows that not only the medical condition, but a long-term social and economic challenge that can be faced for entire families who have experienced Huntington's disease in their life. For my sixth question is, are there any Canadian institutes that aid for treatment in Huntington's disease, including physical therapy, mental health, or community resources that work together in a holistic approach to managing Huntington's disease? So just in Canada, the Ottawa Hospital Research Institute is bringing a new hope to people with Huntington's disease through an inactive clinical trial of gene-targeted therapy. And this trial is testing a promising approach called RNA interference, which targets or silences the specific genetic sequence to prevent the production of toxic Huntington's proteins from producing. Although it is nowhere near a cure, but it's in hope of slowing down or even stopping the progression of the disease. Also, the University of British Columbia has a physical therapy and research clinic which aids with people that have illness or injuries that affect their mobility. Since Huntington's disease gradually affects the muscle control and mobility of individuals, physical therapists can help reduce the risk of fall and improve posture and teach exercises to support independence and in everyday activities. Additionally, a holistic approach to managing Huntington's disease focuses on treating not only physical symptoms but emotional, mental, and social challenges that come with the condition. And the Canadian Mental Health Association specifies in supporting individuals recovering or during illness. Mental health supports is equally important because Huntington's disease can strongly affect emotions, behavior, and thinking, and many individuals experience severe anxiety, depression, and frustration, and also personality changes as this disease progresses. Also, psychologists and counselors and support groups can help patients and families cope with the stress and process and emotional well-being through the progression of dealing with someone with Huntington's disease, because it is a god-awful disease that yet has no cure. But if we could find ways to find treatments that are possible, then that will help so much.